Ladies and gentlemen, would you please welcome Dr. Lynn Goldman, the Michael and Lori Milken Dean of Public Health at the Milken Institute School of Public Health.
Good morning. It's wonderful to be here with everyone this morning. As the Dean of the only School of Public Health in the nation's capital, I am delighted to be introducing our very special guest this morning, the 22nd Secretary of Health and Human Services, Sylvia Mathews Burwell. In fact, it is especially exciting that Sylvia Burwell is with us today. GW was recently awarded a Healthcare Innovation Award from HHS and the Center for Medicare and Medicaid Services. The $23.8 million award was the result of collaboration between the Milken Institute School of Public Health, the Rodham Institute at the GW School of Medicine and Health Sciences, and 20 other community partners, including clinical care systems, hospitals, technology firms, and the DC Department of Health. The project will develop a shared information technology system that will rely on mobile technologies, home testing, and an integrated care system in order to prevent HIV infection and provide better care for those who already have the virus right here in the District of Columbia. It is an exciting opportunity and reflects the spirit of innovation and results-driven approaches that have guided Secretary Burwell's career, as well as her commitment to the mission of ensuring that every American has access to the building blocks of healthy and productive lives. Secretary Burwell was sworn in on June 9, 2014. She has called for the department to operate under three guiding principles: to deliver results on a wide range of complex issues, to strengthen relationships to drive success, and to build strong teams with the talent and focus needed to deliver impact for the American people. Most recently, Secretary Burwell served as Director of the Office of Management and Budget, where she worked closely with Congress to help return to a more orderly budget and appropriations process, bringing much needed stability to the economy and to middle-class families. She led the administration's efforts to deliver a smarter, more innovative, and more accountable government. She oversaw the development of President Obama's second-term management agenda, including efforts to expedite high-impact permitting projects, drive efficiencies, and improve customer service. Additionally, she has worked to ensure that our regulatory system protects the health and safety of Americans while promoting economic growth, job creation, and innovation. Prior to serving in the Obama administration, Secretary Burwell served as president of the Walmart Foundation in Bentonville, Arkansas, where she led efforts to fight hunger in America and empower women around the world. Before joining the foundation in 2012, she was president of the Global Development Program at the Bill and Melinda Gates Foundation in Seattle, Washington, where she spent 10 years working on some of the world's most pressing challenges, from vaccinations to children's health, to agricultural development. She also served as the foundation's first chief operating officer. During the Clinton administration, Secretary Burwell served as Deputy Director of the OMB, Deputy Chief of Staff to the President, Chief of Staff to the Secretary of the Treasury, and Staff Director of the National Economic Council. Prior to joining the Clinton administration, Secretary Burwell worked for McKinsey & Company. She has served on the boards of the Council on Foreign Relations, MetLife, and the University of Washington Medical Center, among other organizations. Secretary Burwell received an AB from Harvard University and a BA from Oxford University, where she was a Rhodes Scholar. A second-generation Greek American who grew up in Hinton, Washington, she and her husband live in Washington, D.C. with their two young children. Truly an accomplished, truly a skilled manager, truly a wonderful new Secretary of Health and Human Services. It's my pleasure, on behalf of the George Washington University and the Milken Institute School of Public Health, to join me in welcoming Secretary Burwell.
Thank you, Dean Goldman. It's great to be here. with you at GW today. This institution is a tremendous leader on so many health and human services issues, from research that is revolutionizing the treatment of cancers, to biomedical engineering, to your work training the next generation of doctors, nurses, social workers, and perhaps cabinet secretaries. I've had the privilege of working with many GW colonials, including many of the talented members of our staff at the Department of Health and Human Services. When you think of all the giants who have come through this university, it's astounding. The great Robert C. Byrd from my home state, Red Auerbach, Senate Majority Leader Reid, Senator Enzi, and the founders of organizations as diverse as Emily's List, ESPN, and Operation Smile. Now, all these people had two very big things in common. The first, of course, is GW. The second is that each of them found their own road to impact. And I want to take this opportunity this morning to share some thoughts with you as you look to find your own way to that impact. I've been at HHS for about 3 months now, and it is the chance of a lifetime to lead and be a part of this department at such a unique moment in our history. In fact, I should mention, we have 2.5 years to go. There are openings and we're hiring. I was honored to accept President Obama's invitation to lead HHS because there is so much potential to deliver impact that touches so many lives. I can't imagine another place where you have quite the same opportunity to work at the intersection of policy, management, leadership, impact, and some very big challenges. Since I joined this team a year ago, I found that President Obama emphasizes results, partnerships, accountability, and sound management. This is the way I've always tried to work, and it's how we're going to work at HHS. We believe in building bridges, relationships, and strong teams that have the talent and focus necessary to deliver results. We believe in managing well. We believe in transparency, and we believe in impact. Impact on behalf of the American people we serve. They are our bosses, these hardworking Americans who rely on the work of our department as they look to obtain the building blocks of healthy and productive lives. Whether you're talking about the Affordable Care Act, early childhood education, or the fight to stop Ebola, I believe the best paths to progress and impact are through this sort of leadership and management. What's central to all this is not politics, it's progress, setting aside the back and forth and instead choosing to move forward. I'm a parent, and when I think about the moms and dads sitting around their kitchen tables trying to make big decisions for their children, they don't care whose idea something was. You don't have time for that when you're trying to figure out how to pay the electric bill, or how to pay next year's tuition, or how to get the kids to get the homework done. You just want results, and you expect folks in Washington to look for the common ground necessary to deliver. This is the approach we bring to big challenges that we face at HHS. Each of us finds our own leadership and management philosophy in our own way. I learned fundamentally about the importance of relationships growing up in a place where my mom knew the one day I was tardy for school because I was late for the 9 a.m. class she was teaching. The values I learned growing up in a beautiful place called Hinton, West Virginia, are what anchor how I manage, how I work, and even what I work on. You might think about what values and experiences got you here to GW and are going to take you beyond. Hinton is the kind of place where relationships and trust matter. It's the sort of community where neighbors tend to look for the best in each other, and everyone feels a personal stake in contributing to the common good. As I've gone on in my career to manage budgets, including the federal budget, I've often thought about how in our small community, every dime counted. People worked so hard for the money they brought home, I watched the parents of many of my friends commute to difficult, often back-breaking work in the mines. I saw my papu, which is Greek for grandfather, get up to open his restaurant at 6 a.m. He was a Greek immigrant and taught me to be grateful for the gifts this country gave to our family. His restaurant was called Denny's, but not that Denny's. There was no Grand Slam. It was the English translation of his Greek name, Dionysios. I learned about customer service and delivering results at Kirk's, home of the hungry smile. If you were the person who got stuck dipping the hard serve ice cream after Sunday church services, you just smile and keep on dipping until every last cone was dipped. And it was pretty simple to measure results. If you were asked to deliver 2 scoops of maple walnut and you gave someone a scoop of strawberry, you didn't deliver the maple walnut result that customer wanted. Service in the community was also important to my mom and dad, and I think that's why it's so important to me today. Mom was the president of the Church Women. She was a member of the Business and Professional Women. She was a member of the Service Club, and she was on the State Board of Education. Dad was in the Lions Club, he was in the Elks Club, and was always the trait education in the citizenship pageant. And we had a rule in our house. At Halloween, you had to trick or treat for UNICEF before you could trick or treat for candy. Fast forward a few years, and I still draw upon these values and experiences, whether it's putting the customer first, valuing service, or looking to find the best in others, even when you don't agree on everything. I've been fortunate in my career to be a part of organizations that are very good at strategy. I've also been parts of organizations that are very good at execution. I believe in leadership and management that are good at both strategy and execution, because this is the difference between great ideas that change lives and those that don't. My management philosophy is built on 3 principles: impact, prioritization, and relationships. Now, I've said the word impact quite a lot already. It's why I do what I do. When we tackle a problem at HHS, I make sure that we set out a clear definition of impact from the beginning. What do we hope to accomplish, and who do we hope to accomplish it for? I think a lot about those moms and dads at the kitchen table and how the actions we take will impact them. They are our boss. And so are young women like Savannah Goodland, who had to wait tables on a broken ankle that she'd wrapped herself until she got health insurance. So are our neighbors who are beating addiction, and so are children who are attending Head Start. All these people are our bosses at HHS. Our boss is also the taxpayer. People like those miners from Hinton work hard for their paycheck, and they deserve a government that works and is strategic and efficient in spending their hard-earned tax dollars. That's one of the reasons that prioritization is so important to me, because setting priorities and staying focused are how you get to efficiency and impact. Determining what options are available, what policy levers are there, what will they do, what you're good at, and what your partners are good at. All these things are the things that make government work. In order to deliver which levers and initiatives are the most efficient and effective, we're data-driven at HHS. And I'm a big believer in metrics, benchmarks, and analytics. If you're serious about delivering results and looking out for the taxpayer, you need to know whether what you're doing is actually working. All these things have something in common. They need great people to make them happen. And that starts with building teams with talent and focus necessary to deliver the impact that the American people expect and deserve. So my very first days at the department, I've been working to retain the great talent that was already in place and to recruit more of the best and the brightest to join us. As far as our external relationships, I'm a big believer in the old cliche. Relationships are built on trust. Transparency builds trust, and it's something that we take very seriously. Even if the numbers aren't quite where we want them to be, we're going to tell you about it. Take, for example, our recent announcements about the numbers of consumers in the health insurance marketplaces who have citizenship-based data matching issues. It may not always make for the best and most attractive press release, but we believe that you build trust by sharing the news, both good and bad. We also believe in the power of good ideas, and we understand that nobody has a monopoly on them. That's why active listening and being responsive are so important. Hearing ideas, input, and feedback, and putting them into action wherever possible. I've told my staff we should work toward the goal of returning letters we receive from Congress within 30 days, no matter who they're from. Now, many of the best ideas come from all different sectors of our society. I've been blessed with the opportunity to work across a number of different sectors, doing everything from scooping ice cream to leading Walmart's efforts to feed needy families, to leading the efforts at the Office of Management and Budget. Along the way, I've learned to have respect for every sector of our society and to believe strongly that there are really more things that we have in common as Americans than we have that are different. That's why when we hear good ideas from the other side of the aisle, we want to listen. So when Republican Congressman Fred Upton asked me to join him for a discussion on 21st century cures later this week, I said, sign me up. One of my first meetings as secretary was with the governors of both parties. I said to them, if you're finding our department isn't being responsive, I want to know about it. I also told them that I hope to work with them, regardless of party, to bring more states into the fold on Medicaid expansion. And recently, we were able to do just that with the state of Pennsylvania that has a Republican governor. Hundreds of thousands of people can now get the health care coverage they deserve as a result. The fact of the matter is, there are always places where we can work together. There's nothing ideological about curing cancer. There isn't a Democrat or Republican way to solve Ebola. There isn't a liberal or conservative approach to preventing suicide. We have the opportunities to work together across the aisle on issues ranging from medical research to global health security to early education for our children. The American people are sending a clear signal that they want us to work together on healthcare too. When you start a job like mine, you end up taking a lot of time in the first few months to listen. I was once told that God gave us 2 ears and 1 mouth for a reason. I can tell you that what I've been hearing over and over, whether it's from friends that I talk to back in West Virginia, to business leaders, to elected leaders, and to my new colleagues at HHS, enough already with the back and forth. We just want to move forward. What that mom and dad at their kitchen table really want to know is, what kind of coverage is available to me and my family? Can I afford it? And is it any good? What I hear from business leaders is that they're in the same place. They want to work together on solutions while making our care better and investing dollars wisely. They want a better healthcare system, and so do we. So what I've told my team at HHS is that we're not here to fight last year's battles. We are here to deliver on affordability, access, and quality. Surely, these are goals we can all agree on, no matter where you happen to live, whether it's West Virginia, Washington, or Wyoming or Washington State. By these metrics, the Affordable Care Act is clearly working. Healthcare is more affordable for families, businesses, and for our economy as a whole. Coverage and services are more widely available for more people. Doctors and hospitals are delivering better care to their patients. As we've said all along, we can do more and we can do better. The Affordable Care Act is not about making a point. It's about making progress. It's about leadership and management, defining our goals, putting the right teams in place, setting the right priorities, and building relationships with anyone who wants in: consumers, issuers, providers, elected officials, faith leaders, civic organizations. We want to work with people across our country and across all sectors on priorities we can all get behind. Helping more Americans get covered and stay covered. Making healthcare more affordable for working families. Making sure that healthcare.gov meets the standards the American people expect and demand. Expanding Medicaid. Working with doctors and hospitals to deliver quality and affordable care. Working with insurance companies to offer more choices to more people in more regions of our country. So what you'll be seeing from us in the days and months ahead is an open invitation for partnership and a call for good ideas, no matter where they come from. We'll be looking to build and strengthen relationships with anyone and everyone who shares our passion for helping Americans obtain the building blocks of healthy and productive lives. And we'll insist that the actions we take are managed well, with an eye on protecting the taxpayer and delivering impact for the boss. Let's move beyond the back and forth. Let's move forward together. Thank you.
Ladies and gentlemen, the Secretary will now answer a few questions by George Washington University students. Would you please welcome to our stage Seth Gold, class of 2016 from the Milken Institute School of Public Health.
Good morning, Madam Secretary. On behalf of the student body, I'd like to congratulate you on your new role as Secretary of Health and Human Services, and thank you for being here this morning. I'd like to kick off our Q&A with a personal question, if you don't mind. You mentioned that you're a mom. Do you have any tips on how to achieve the ideal work-life balance?
Well, I think ideal is something that I'm not sure any of us hit. But in terms of an approach to this, one of the things that I think is important harkens back to something I said in the speech about prioritization. And the prioritization that one does in the work so that you understand the key things that you're focused on. And that prioritization for the work, I think, is one of the things that helps put the work in the order that it should be and contain it in the way. There's the other part of prioritization, which is making sure that people know that your family is a priority and being clear about that articulation of these are the parameters and this is how I work. The other thing that I would add is that I'm very fortunate to have a great partner in my work-life balance and my husband and my children in terms of how they support that effort. And the last thing I would just add is I talked a little bit about people in my remarks and how one wants to build great teams. And because actually I've held 4 jobs in the last 4 years, you might think I can't hold a job. But so that means I've started and built teams a number of times actually in the near term. And one of the things that I have found is that actually valuing this question of respect for family and respect for those things is an incredibly important part of recruiting high quality people. Because often some of the best people that you want are people who care about these issues as well. And so it is something that I am seeing as I continue to do recruiting, that keeping that as a priority for me and articulating it and manage teams in that way is something that helps with recruiting.
Wonderful. This question was submitted by Stuart Portman, a graduate student in the Milken Institute School of Public Health. It's a little long, so please bear with me. As a graduate student working towards an MPH in health policy, I am learning to blend policy development and political feasibility to best address the concerns of the population. In the current environment, much has been said about partisan divides and the inability to find common ground. As a part of a new generation of health professionals, I reject that as the status quo. Here's the question. How does improving communication between yourself and Congress, something you discussed during your confirmation hearings, work to better the relationship between you and HHS and legislators? Furthermore, do you believe that improved communication about policy goals can correct many of the misunderstandings in today's health environment?
Thank you, Stuart. So I think I spoke a little bit to this issue and the importance of relationship as I talked a little bit about one of the biggest priorities that I believe that as a manager I need to have. And the issue of relationship, I think, is important for a number of reasons. And I will admit, when I was younger, the idea that I would put relationship as one of the core goals was something that would be foreign, because it was a means, not an end. And so analytically, I wanted ends in terms of goals. But this is one that is important enough that as I have gotten older and had more experience, that I believe is incredibly important. And it gets to a little bit of what was in Stuart's question. The issue of having relationships is a lot about how you share and move information. Because one of the things that I find as we try and work through things in this town where things have gotten incredibly contentious at times is, can we all start with the same fact base? And often we're not doing that. And so if we can at least get to the level where we're starting with the same fact base, we may have different ways of interpreting those facts, but if you can start that you're on the same fact base, and if you have a relationship enough that you can have a conversation that you actually know where the two of you disagree, and that's a lot of how one brings things together. And that relationship is also about trust. And often, to get to solutions, and whether it's in the private sector or the public sector, it's about negotiating. Some people might use the word deals. But in doing that, that idea of trust, if you think about what Ms. Murray and Mr. Ryan had to do last year to negotiate the deal that we had on the budget, a lot of that actually was about them building that relationship of trust, because they were carrying on both sides all the needs and desires of their teams on both sides. And having that relationship and trust is an important thing, I think, to finding the places where one side's not going to get everything, the other side's not going to get everything, but we can find a path that gets us to move forward.
Wonderful. This next question comes from Angela Rick, a graduate student in the Milken Institute School of Public Health. And she asks, your background and previous experience are different from those of HHS secretaries before you. How does this make your approach to the job different? What do you see as your biggest challenge?
So I am a bit different from most recent previous secretaries, and probably a little more similar to Secretary Shalala from a number of years ago in terms of my background, not being an elected official. And so I think my style, approach, and what I bring to the department is a little similar to Secretary Shalala. With regard to, and I've spoken to that in terms of the things I think I spoke to you all about today, in terms of those priorities and how I think about managing and running and leading the department. I think also, though, one of the things that's important, and this gets to challenges, one of the first things I did was to call all of the other former secretaries, so that I can make sure that I could learn from them and understand the things in places where they think my background might have some spaces that listening to them and learning from them is important. And whether that is my direct predecessor, who I've spent an enormous amount of time, and I'm grateful for all her help and support, Secretary Sebelius, but also Secretary Levitt, Secretary Thompson, and others, actually even going back to Secretary Sullivan from many years ago. So that's how I'm approaching this issue of challenges. The other thing, if the question was about challenge more broadly, I would just say, having been at the department about 100 days or getting close to, one of the biggest challenges is how to make sure that in a short period of time, 2 years, 4 months, and a few days, that we take advantage of all of the potential opportunities of the department, and how do you create an organization that can maximize for that? And that's one of the things I think is one of the biggest challenges.
Wonderful. Tim Mendino, a health administrative student from the Milken Institute School of Public Health, asks, from a public health perspective, prevention of disease is much less expensive than treating an illness or disease. What barriers prevent us from using more resources to tackle the social determinants of health that are the key means of preventing diseases? How do we overcome these barriers?
So the issue of prevention is one that I think is tremendously important, and we're at a critical place as we're thinking about changing our health delivery system to one that is less fee-based and more impact-based, because I think we know the importance that prevention plays in that, both in terms of how we'll save money and how we'll get better results. But one of the questions, I think, is it is not always easy on the prevention side. And my experience through a number of experiences, whether it's at Gates or at Walmart, is when you think about prevention, the first thing is people have to have the knowledge. So let's take, for instance, healthy eating. they need to actually know what healthy eating is. They need to understand how that's defined and what that would mean eating. The second thing is they need the tools. And the tools come in various forms. Some people don't know how to fix fresh vegetables or haven't used them before. Think about if you've never really cut a pineapple, would you exactly know, or even a pomegranate? How do you get all those seeds out? But even your day-to-day things that people may not have experienced, so tools. And tools also come in the form of affordability. So many of the things we're trying to teach communities about prevention and healthy eating, do they have access? Are they in a food desert? Even if they're not in a food desert, are they in a place where they could afford the fresh fruits and vegetables that we want to encourage as part of healthy eating? So the tools. And then the third thing is culture and behavior change. And probably if we did a little survey here, did everybody get up this morning and exercise? And did everyone eat, a serving of fruits and a low-fat, we could go through it. And I'd say most of the people in this room are good on 1 and 2. But even those of us who have those things, and so it is about behavior change. And so to get improvement, I think we all have to as a nation, and not just as the government, but as communities and individuals, we have to work against all three.
Wonderful. And you just made me feel a little bit bad because I did not work out this morning or eat my fruits this morning, unfortunately.
I hope everybody had breakfast at least.
Sorry. And then this final question does come from me. What is the biggest surprise thus far from your career as secretary?
So the question of the biggest surprise in the first 100 days, actually, there's been a recognition of the magnitude and the volume that we've had, and that's not really a surprise. It's just whether it's unaccompanied children. Many of you all know we've had 12,000 children in the care of the Department of Health and Human Services at one point. Many of you are probably familiar with Ebola, and that really wasn't a surprise. But I think, interestingly, the surprise has actually been a positive one. And I've been very, very fortunate to have the chance to work in organizations where people have real passion for their work, whether that's the Gates Foundation, working on hunger at Walmart, working in the government the 2 times that I've been there. But what is actually surprising is the extent of the passion for their work at the Department of Health and Human Services. So as I go out and meet with each of our operating divisions, the FDA, our organization that does substance abuse and mental health, and all of these organizations, to a person, every person I talk to tells me that their work is the most important work in the department. And I welcome that, because that kind of passion, including a note from a librarian who wanted to make sure I understood what she and her library had to offer within the HHS system. And so it is that passion. I knew that people would care, but I am surprised by the level of passion and intensity that I meet everywhere I go in terms of the HHS staff.
Wonderful. Thank you so much, Madam Secretary. On behalf of the entire George Washington University community, I want to congratulate you again on your new role as Secretary of Health and Human Services, and to thank you for sharing your leadership view with us this morning. And I especially want to thank you for bringing your message to GW and giving the students of this university an opportunity to directly engage with you. As we are shaping our own public service futures and developing a deeper understanding of the challenges we face both nationally and globally, we look to you and leaders like you, not just as role models, but more importantly as teachers. We learn from your actions, we learn from your leadership, we learn from participating in events like this today. Being able to ask you questions directly has been an extraordinary opportunity for the students at the George Washington University this morning. I know I speak on behalf of all of the GW community when I say that we hope this morning's event and Q&A session with you is the first of many ongoing direct conversations between you and the students here at the George Washington University. Madam Secretary, thank you so much again.
Thank you, Seth, very much. And thank you all for having me today. It was a pleasure to be here. Thank you so much.